Hello, everyone. My name is Robert Bednars, and I am a junior doctor in Dundee, Scotland, and you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. So, hey everyone, this is Robert, and this week's topic we're going to be talking about something called endometriosis. And endometriosis is a gynecological condition where a woman suffers from a tremendous amount of agonizing pain, usually prior to her menstruation. This is unfortunately easily overlooked because when a young girl is starting to have her periods, it's something new for her and she isn't necessarily sure of what to expect. And when they go to their primary care physician with this new menstrual pain, doctors are just quick to say, take some painkillers and use a warm blanket or a warm water bottle and try to ease the pain. But the pain for these young women who have endometriosis is at a greater intensity, and it's hard to rate pain as both patient and doctor since pain is very subjective and depends on the patient's threshold for pain. So, to explain that, for example, if you take two people who are getting the flu shot, one might not feel anything at all, whereas the other person might feel a lot of pain from it. And this is excluding any exceptions like maybe they hit a nerve or a bone or anything like that. So, what is endometriosis exactly? First, we have to understand a little bit of the uterus. And the uterus is, from my understanding, after asking some women, just seems like its main purpose is for all hell to break loose every month. But I want to briefly explain what it's made up of and what is happening within the uterus every month. The uterus has three main layers, and going from the outside going in, they are the perimetrium, the myometrium, and then the innermost layer is the endometrium, which is what we're going to be focusing on. The endometrium consists of endometrial cells, and they have estrogen receptors, which lets them have their proliferation stage, secretion stage, and then either shed, also known as the menstruation cycle, or stick around and form a placenta for the baby that's being formed. If no baby is to be expected, then the ovaries will keep producing estrogens every month, causing this whole menstrual cycle. That part is important to know to how we manage this condition later. So that's all normal physiology. And in endometriosis, however, this is when there are endometrial cells found elsewhere in the body. These cells are supposed to be only found within the uterus and nowhere else. But what happens in endometriosis is that these endometrial implants, we call them, are found on other parts of the body, most commonly on the ovaries and nearby ligaments. But it is possible for endometrial implants to be found anywhere in the body, including the bladder, bowels, or even on the lungs. The issue is that these endometrial implants function similarly to the endometrial cells found inside the uterus. So they also proliferate, secrete, and then shed. So cyclical bleeding can happen on the ovaries and other organs as well. The ones that are found on the ovaries are sometimes called chocolate cysts because of all of the old blood and debris found inside the ovary. These can rupture, and that can cause very, very severe pain, and surgery needs to be done. Why does this happen? Guess what? We're not entirely sure, but we do have about five theories as to how this happens. And the most common one that at least I got told in medical school is this retrograde menstruation theory, where when a woman is having her period, some of the shedding that was supposed to be expelled through the vagina actually goes back up through the fallopian tubes, and there's a bit of space between the fallopian tubes and the ovaries, so these endometrial cells tend to escape and cause havoc on other organs. However, there are other theories as to how this might happen, and if you'd like to know, you can always email me at thepatientwillseeyounow@gmail.com, and I'll gladly explain it to you. Almost 1 out of 10 women have this disease, so it's quite common, and it affects women between the ages of 15 and 44, but can be found as young as 8 years old. The symptoms you'll most commonly hear are pelvic pain, painful periods, painful sexual intercourse, And then, depending on where these endometrial implants are, can also cause other symptoms of other organs like painful defecation, painful urination, and even abdominal pain. So, as you can see, pain is just a major thing here in endometriosis. 30 to 40% of these women are considered subfertile. However, pregnancy is still very possible for these women. The only way we can diagnose endometriosis is by a laparoscopy procedure, and then we could confirm it by a biopsy. Treatment is based on the severity of the condition because some women who have endometriosis might not show any symptoms really, so they're fine without any medications. However, if they are really severe, we focus on managing the pain, limiting the progression of these implants, and then addressing the subfertility. Most women will be on some sort of oral contraceptive pills or device in order to stop having these periods, and this will therefore minimize the monthly cycles these endometrial implants will have. Another option is if the woman doesn't want to have children or doesn't want to have any more children, then a hysterectomy or surgical removal of the uterus and bilateral salpingo-oophorectomy, which is just a fancy medical term for surgically removing the fallopian tubes and ovaries, is the most definitive surgical management of endometriosis. So now that we covered the basics of endometriosis, let's hear what Amy has to say and follow her journey and what it's like living with endometriosis.
Hello.
Hey, good afternoon, Amy. How are you?
Good. How are you?
I'm doing great. This is Robert from the Patient Will See You Now podcast. I'm calling you today about endometriosis. And the first question is going to be, how did it all start? When did you notice that something was different? What did you do? And we'll go from there.
Okay. So I got my period late in life, as compared to others. It was 12. And pretty much right away, I knew that there was something different. My friends didn't seem to have the cramps and, other symptoms, bloating. They were still able to go to school. They were still able to play sports. They weren't having to go to the ER, just for their periods. So I knew right away that something was not okay. And, my mom took me I grew up in a small town, so like a really small town. So we had access, unless we wanted to, drive an hour and a half to see, a doctor from, a larger city or have a better selection. I kind of had to deal with what I had. So she, took me to, this was a little bit later. I kind of dealt with it for some years, just with some ibuprofen and, heating pad, things like that. But when I was 16, my mom was just kind of like, okay, enough is enough. We're going to an OB. So we went to that small town doctor, and he put me on birth control and was just like, oh yeah, sorry, you have bad periods and there's not a whole lot we can do about it. And sent me on my way. So for the next 2 years, I just kind of went on birth control, and, the symptoms were managed mostly, but there were some really like bad times. It started getting worse and worse as the years went on. And what later I know now were like cysts probably rupturing and forming, and, the endo flaring up. I know that now. I didn't know what was happening to me back then. And so I kind of grew up, and I got on my own insurance, and I was just on birth control and having ultrasounds, and I would have, they would notice cysts on my ovaries, and just, they weren't super large, like not large enough for them to go in for surgery and remove them, but, to kind of manage with birth control and over-the-counter medication. And, man, it got really bad about, let's see, I was 25. I think it started getting like really unmanageable. And I happen to be living in Cleveland now. I moved out of that small town.
Hmm.
We have many large hospitals, like really great hospitals here, the Cleveland Clinic and University Hospital. So I went to a doctor up here, and he really listened and was just like, yeah, I think we should do surgery and take a look and see what's going on. They could see via ultrasound that I had a rather large cyst and another one forming on my right side. So that's what we did. We went into for surgery, and he was just like, yeah, you have endometriosis. And we took the cysts out, and I freed up as much as I could, and he got rid of some scar tissue and got as much of the endo out as he could. And it was basically just like, here are your options. You can go back on birth control. You can manage it with over-the-counter medication. You can do all of this. So I kind of went through the cycle of birth control. It just kept getting worse. I was getting cysts every month. I could feel them, what I believe was them rupturing, which is like the most excruciating pain. I can't even explain to you some of the things that I experienced, but just the worst pain you can imagine that I have ever had to go through anyway. And that took me back to him just many times, and the birth control wasn't working anymore. We tried different forms of birth control. We kind of went down the list of, the things that they know to do for endometriosis. And so here I am. I'm almost 30. So it's been a few years now that I've actually been diagnosed. But, I do believe that I've had this since puberty.
So, wow, that was a lot. And I have so many
Yeah,
questions to ask.
sorry.
No, that's great. So, going from the beginning, you said this all started around when you were 12, you think, right?
Right.
So you went to your OB at 16, and that's when the doctor first was like, "Oh, nothing's wrong. Here's some birth control. Try this out."
Yes.
How did you feel then? What was your mentality? It was like, "Oh man, I'm taking birth control at 16," or what were you thinking then?
I didn't really feel any which way about it. My parents were fairly liberal back then. And I don't think that they were they didn't have any objection to it. Just be like, not to get on a weird subject, but like I was in high school, and they didn't want me having children.
Mhm.
So this was kind of like a backup. They were just like, okay, she's 16. This is for, her health and to, get her through. But, also probably not a horrible thing that she's on birth control.
So it's like, oh, plus she won't have kids.
Right. Not
Right.
that I was promiscuous or anything like that. There was none of that going on, but it was just kind of like a thing where it was like, okay, like she's of age, she's a teenager, and, teenagers go on birth control all the time.
Gotcha.
So.
And then you said when you were 18, the symptoms were getting worse and worse. Can you describe that?
Yeah. So when it started out, I remember like when I first got my period, and it was just like a monthly thing, kind of like the first couple of days of my period just were really bad. And I remember just being like, what is wrong with me? Like, what is going on? I have to stay home from school, 1 or 2 days every month, like just because like I can't do it. And then it started kind of like mid-cycle to where like I could feel where I knew a little bit more about biology, and was like, when I was ovulating, I was having a lot of pain, which is not normal, obviously. And so like that would put me down for a couple of days. And then my period would put me down for like an entire week. And then I would get like these random kind of flare-ups, these like sharp jabbing pains, like, right in my pelvic area. And, it just kept getting worse and worse to where it was like, I would have that for a week. And then, 6 months later, it turns into like, oh, I'm having these 10 days a month now. And, I'm taking ibuprofen like, 2 weeks out of the month. And, it's not good for you to take that much medication. And but you can't not take anything because you have to function. I have to get up and go to work and go to school.
By any chance, from taking all the ibuprofen and pain meds, did you suffer from any ulcers as well?
I did. I had some, this was so long ago. I do remember them saying that I had an ulcer when I had a colonoscopy done, because my stomach was getting messed up. I don't really want to say that it was because of the medication, but it certainly didn't help. I was just diagnosed with like IBS after that, but they did say that there was an ulcer and like some polyps and, things like that. So
They also diagnosed you with IBS at the same time? But this is before they knew it was endometriosis.
Around the same time. This was a little bit before the endometriosis that I started having stomach issues.
Gotcha. And then you said that the cysts rupturing are the most excruciating pain. Is there any other way you can describe it, or what is that like?
Right. So for me, when it would happen, it would typically be like late at night. I don't know why, but I always remember it happening like late at night, in the middle of the night, wake me up from my sleep. And like, I wouldn't be able to either like get out of bed. Like you can barely even like make a noise. There's so much pain. Like I just remember the last time just thinking like, I don't even know what I'm supposed to do with my hands. I'm in so much pain right now. Like, you're shaking, you're sweating, and then all of a sudden it's like, boom, gone. So it would last for, a half an hour to 45 minutes. And then I would feel a little bit nauseous afterwards. And that would be it. I would just be able to go back to sleep. I'm sure that that's not everyone's experience, but every time that's what it would be. It's just to a point where like, you can't even like vocalize anything.
Oh man.
Like the amount of pain that you're in, you can't even like say a word. Like, I can't even like wake my partner up and be like, we got to do something, because you can't move.
That sounds terrible.
It is. It's horrible.
And then at the age of 25, that's when you met a gynecologist in Cleveland, and he was like, let's do some surgery on the cyst.
Yeah. So he did the ultrasound. He saw a cyst and was like, I don't really think that that this cyst in particular needs surgery, but given he did the internal ultrasound, and then he also did, just like the regular one that they use to like look at babies and stuff.
Mm-hmm.
I don't, just a normal ultrasound, I guess.
Yeah.
And he could see it. And, he didn't think that it was big enough to do surgery just like for that, but he was like, I'm like pretty positive that you have endometriosis, because he could see something from the internal ultrasound and made him believe that, something to do with my uterus. I'm not positive what he saw, but he was just like, we're going to do a lap and we'll figure it out. So it was after that I got the official diagnosis of endometriosis.
So, and when you say laparoscopic procedure or laparotomy?
Yeah, it was a laparoscopic procedure where they put the camera in.
Yes,
and then they removed some of the endometriosis. He took out as much as he could, and then, sewed me back up.
So for 13 years, you were undiagnosed with this painful disease, right?
Yeah, I heard it all. I heard that I was just like a baby, that I just needed to, get up and move around, that I just needed to, ibuprofen. Everyone has cramps, the same thing.
It seems to be with everyone with endometriosis when they're young. It's just like, hey, just toughen up. And they don't understand what it's like. They just think it's a normal period. And, oh, come on, toughen up a bit.
Right. Yeah, no, I heard that. But, the females in my family, thank God that they didn't really listen, because my mom and my grandma would take me back to the IV, the OB, and that same OB. I mean, he didn't he's just a small town OP. Like, I don't know how else to put it. I don't think he had a lot of experience with endometriosis. So he certainly did the best that he could at that time. But they would take me back. Oh my gosh. I was back there probably 6 times a year. Like, they would take me all the time and be like, something is wrong. Like, you know, I have an older sister. You know, my mom was always just like, you know, she didn't go through this. I didn't go through this. You know, my grandma would take me back. She would pick me up from school because my mom and dad both worked. So if I had to come home from school, she would have to come pick me up, my grandma, and she would just take me just straight there and just be like, you're looking at her because there's something going on right now. Like, she is in tears. Like, she can't stand up straight. And he was just like, yeah, sorry. Here's a prescription for Tylenol 800. And like, I'll see you next month, I guess.
Well, it's amazing that your family, listens to you and your pain, and they want you to get checked out. They want you to get better. They're not, the type of people that, also say, hey, this must be nothing. Let's just keep going with our
Right.
lives. My next question is, how did you react when you got your diagnosis? How did you react to that?
Once he mentioned it to me, saying like, hey, I really believe that you have endometriosis, I went home and I did. He was like great, and he gave me a lot of information about it, and every symptom just lined up, and everything, the stars kind of aligned, and I was just like, I know that I have endometriosis. Like, I know that this is it. Like, it has to be it. And so after I was diagnosed, I was just like, yeah, I knew it. Like, I felt validated in my pain for so many years.
So you were relieved that you were able to finally put a name to what you've been feeling for the past 13 years, right?
For sure. A lot of relief.
So since your diagnosis, what are some changes in your life that you've made that now that you know what it is, what are some like big changes that you had to make, or maybe some small changes that people wouldn't have thought of?
Well, there's a few things that have happened. I kind of cycled through different types of birth control and, medication and home remedies, things like that. And it was getting kind of unbearable. So I went back 6 months ago. It was almost exactly 6 months ago. And I, talked to him, and he was just like, there's this new medication out and we can put you on it. You can only be on it for 6 months. And what it's basically going to do is put you into a medical menopause.
Do you happen to know the name of it?
You can do that. Yeah, it's Orilissa.
Okay.
So I did that. I did that for 6 months because he was basically just like, you can either keep keeping on with the birth control, and over-the-counter medication, because I'm not going to take narcotics for like an extended period of time. That's just not really, I have an active job, and I'm just not going to do that. So, I gave it a lot of thought, and I went on the Orilissa, and I went on that for 6 months. And, there's a lot of side effects with that, and it's not really the cure all for everything, but for me, it's been great. And I have virtually no symptoms. And for me personally, I don't have any negative side effects from it. Mm-hmm. That's not the case for everyone. So, people should be really careful taking it. But so that's it. I went on that for 6 months, and I just went back recently because that 6 months is over. And he said, okay, so they just said that you can actually go on this for 2 years now, 2 consecutive years, and you don't have to take a break in between every 6 months like they originally said, because it's like a new medication. I guess they did more studies, or, whatever they do. And so we just renewed the prescription, and here I am. I'm still on it.
So you said that you heard that other people have side effects, and you're lucky enough not to suffer from any of those side effects. But what have you heard from other people that are taking Orilissa?
I've heard that, a lot of depression and anxiety can happen. A lot of things with your it can really affect your mental health. So, if you have, and he kind of went through the whole thing, like asking me, like, if you ever feel depressed, you stop taking this. If you're ever like extremely anxious, abnormally anxious, you got to stop taking it and come back in. I think that those are like the biggest side effects that I hear people talk about are the mental health side effects.
My next question is going to be, has the endometriosis affected your personal relationships with your friends, your family, your significant other in your romance life or work?
So with my friends, not so much. Especially not recently, because I've been able to do anything that I've wanted, really. So if they're, I'm not missing anything. If they're having people over, I'm not calling them saying like, oh, hey, I have cramps, I can't come over. Where before, maybe some years ago, I would have done that every once in a while if it was that time during my cycle. But no, my friends have all been just really supportive. I have, they're just great friends. My family is kind of the same thing. My family has been great support since I was 12 and started going through this. My mom just, she wants grandbabies. So she's like very up in my business about a lot of it. Like, obviously I can't get pregnant right now because I'm technically in menopause, but she wants to come to my appointments a lot and, wants to know everything that the doctor says and if it's going to be possible for me to have babies. But he can't really give me a definitive answer. So, I can't really give her a definitive answer.
Which was going to be my next question, actually. Like, how is that going to work into your life? Do you want kids? If you do, did the doctor explain how that's going to work?
So, yes, we do want a kid. I don't really want more than one child, but, I'm 30 right now. And we would have to do, so I'm married to another female, and we would have to take certain medical steps in order for me to get pregnant anyway. Okay. Because it's not like we can naturally conceive. So, that has always like been the case and been in the conversation. That we would have to take those steps anyway. So from what the doctor is saying is that when I want to get pregnant, I can go off of this medication, and after, a month or whatever timeline he gave me. And I'm sorry, I had this written down and I don't know where that paper is.
All right.
But, that, he would be willing to refer us to a fertility clinic. So, and I'm thinking in his mind, it's not impossible, but he did say that it could be a very difficult process for us. So that's kind of where we're at right now.
So I'm guessing between the two of you, you are the one that wants to carry the child, right? Or
that would be preferred, but I guess she might just have to, huh?
Well, that's always another plan. But I know it's not impossible, but it's definitely makes it a little bit more difficult having endometriosis. Right. So then my next question is going to be, what's your biggest fear for your future? Do you have any fears, or is there something you read that you were like, oh man, I don't want this happening to me?
Yeah. So two big things, I guess, that come straight to mind is not being able to get pregnant and just spending a lot of money to try to get pregnant. And it just, not being possible or just not happening in the end. Mm-hmm. Where we could have been putting that money towards, her carrying or, adopting. So there's one big fear that's going to happen. And then the second fear is just having a hysterectomy. And that's still like not really being the complete answer for it. Because from what I understand, is that I could have a hysterectomy, and as long as the endometriosis, there's some spots of the endometriosis is left in there, that it could still grow and affect me. I mean, those are my two big things. And then having to go on hormones, I'm only 30. I don't want to have a hysterectomy, but I also don't want to be in pain. So it's kind of like one of these things, like, what do you do?
Yeah, it's one of the more tougher decisions to make, for sure. I can imagine how you could be feeling having those options and then thinking what to do for your future. So let's flip it around. And what keeps you motivated to go through all this? What keeps you happy and grounded?
I'm just happy I have a name to put on it now, and that I feel not crazy. Like, there for a while, I was like really doubting myself. Like, do people really not feel this way? Like, do people really feel this way and I'm just like, sensitive to pain or something? Or am I just like a baby? Like, but that's not the case. I think I have a pretty high pain tolerance now, knowing what I know. But, yeah, what keeps me going is, I guess, hoping that I will be able to conceive. And I mean, with this medication, I feel great in my daily life now. I have energy. I don't have any cramps. I'll get, a series of cramps that last maybe an hour or two here or there, but it's nothing like, it is absolutely nothing like before. Just really tolerable. Like, don't even have to take ibuprofen for them. So, I mean, that's just, it's just nice to, go through everyday life and not experience pain. So that's kind of what's keeping me going. I have this like newfound energy and this like newfound, outlook that I don't have to be in pain every day, and I can do whatever I want. And I don't have to worry about like an unexpected period here, or, having some stabbing, sharp pain, in the middle of my work day when it's, in the middle, like where I shouldn't be having them.
Mm-hmm. Matt, it sounds like you've got everything pretty under control now compared to what you said you had earlier in your life.
Right. It does feel in control. I feel in control now. I'm worried about, when those 2 years are up, because I'm like, 7 or 8 months into it now. So I have another good year and 4 months on this medication, but by then I'll be 32-ish. So my biological clock is ticking.
So I was actually going to ask you, did the doctors mention what they want to do after those 2 years are up?
He said basically I could go back on birth control. I could try to get pregnant, or I could have a hysterectomy.
Oh man. Yeah, those are all big options then.
Yeah, they are. Of course, the safe thing to do would just be to go back on birth control and, wait 6 months. And if we decide we're not going to have a child, or she's going to carry her, if we choose to adopt by then, then I could just go back on birth control, wait another 6 months, go back on Orilissa, do that whole cycle just over and over until I go into menopause naturally. And then, all of that's done. Or I can just have the hysterectomy. There are a lot of options, but, if I go back on birth control, I don't think it'll be for very long, just because it doesn't really work for me.
So we're going to wrap this up slowly. I wanted to ask you one more thing. What advice would you have for somebody who just found out they're diagnosed with endometriosis, or someone that knows someone who's been diagnosed with endometriosis? What kind of advice would you give them? What kind of tips, hints, anything like that?
Oh man, I would just say, find a doctor that is willing to listen to you and doesn't dismiss anything that you say, because that's what changed my life. Just finding someone that would actually listen and not just kind of throw away what I was saying and just, go about what he thought it was. And then for someone that knows someone, bringing us heating pads every once in a while would be great. Or just understanding that we can't plan these things out. Flare-ups can happen any time of day, any time of the month. It doesn't matter. Just, we'll get through it. Just give us some time.
Mm-hmm. So I actually have one more question, because the pattern with a lot of these girls with endometriosis is that they themselves feel it when they're young, when they're like 12, 13, 14 years old, and they go to a doctor and they dismiss it for, oh, it's just some pain. Here's some pain meds and live your life. What would you tell that young woman who's around 12, 13, 14, that they're feeling something wrong and they know there's something wrong? What would you tell that girl to do to go and try to get herself, hey, I think it's something more than a regular period?
I mean, really, I think that finding a doctor that is educated in endometriosis and specializes in endometriosis is kind of the key. So if your parents can get you there, then you got to go. Mm-hmm. And if they can't get you there, then, that's rough. I went through it, not because my parents wouldn't take me, just because they didn't know. And you just have to keep going. It sucks. Like, there are some days that you're like questioning, like, can I go through this the rest of my life feeling like this? And, some of the times that answer was like, no, but like, we'll try to get through today. So it's literally like 1 hour at a time, 1 day at a time. It's so cliche, but like, it's just get through that day until you can find a doctor.
And that's why I'm trying to do this to, even for me, like, I'm not a woman. I have no idea what periods feel like. So I can only imagine what that's like. And if I see now a young woman coming in saying, hey, I have some really bad menstrual pains, then I'll definitely be thinking about this just in case.
Right. That's another thing. Like, if someone doesn't even like, female gynecologists, like if they haven't experienced endometriosis themselves, like, how do you differentiate, like, what is just a bad period and, what could be something more like endometriosis? Like, it has to be difficult because you can't, I don't know, but, I think that I knew something was wrong and no one else is in your body. Like, when something's wrong with your body, like, you just know.
And you just got to keep with your gut and just tell that doctor that, like, hey, something's wrong and I need you to check it out.
Yes. And be firm with some of them.
Well, Amy, thank you so much for being a part of this podcast. I really appreciate it.
Sure.
I'm sure a lot of listeners learned something here today as well. And thank you. Thank you again so much for being a part of it. Do you have anything else that you would want to say?
I don't think so.
All right. Well, then that's it.
All right. Thank you, Robert.
Thank you so much and have a great evening.
You too.
Bye. If you liked this episode, please leave a review and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast, please send me an email with a background of what disease you're living with to thepatientwillseeyounow@gmail.com, and I'll let you know if you're selected to be on the show. Don't worry if I haven't gotten back to you right away, because I might get you back for a later show. And if your condition was already mentioned on the show, no worries. I like to show how one disease can affect different people in completely different ways. Again, thank you so much for listening, and catch you next week.